Now we'll be discussing chest X-ray posterior-anterior view in deep inspiration and in not so deep inspiration. Now it's very important for us to understand that if you really want to have a very good understanding of X-ray of lungs or mediastinum or heart, the X-ray must be done if it is done in posterior anterior view in deep inspiration. It means the patient should take deep inspiration and patient should withhold the breath till the X-rays are short. If the X-ray is not short, and then basically you can get a poor quality X-ray image like this compared to X-ray in posterior anterior view in a very good deep inspiration. So both these X-rays are posterior anterior views. Now there is significant differences between the two X-rays. When we can see the anterior ribs, which we can count is this is rib 1, this is rib 2, this is rib 3, this is rib 4, this is rib 5, this is rib 6. So you can see six anterior ribs which can very easily be visualized. Whereas in this X-ray, this is 1, this is 2, this is 3, and this is hardly 4. So there are hardly 4 ribs are visible, anterior ribs. When we look for the posterior ribs, which we can try to see, is this is rib 1, this is rib 1, 2, 3, 4, 5, 6, 7, 8, and 9. Whereas in this, there is 1, 2, 3, 4, 5, and hardly 6. So there are only 6 posterior ribs are visible, whereas here there are total 9 posterior ribs are visible. The other things which we can see in if the X-rays is taken in poor inspiration, not in deep inspiration, then this type of or the upper mediastinum will always appear very much enlarged, very much wide. Just compare this mediastinum here and here. Here it is so much slender, so much narrower, but here it is so much distended or so much enlarged. This is all just because the patient has not taken deep inspiration. The lower border of heart or the base of the heart will always appear very flat and transverse, whereas in here the heart base will appear globular. The X-ray on the X-ray with poor inspiration, the heart shadow will not be seen very well, whereas in deep inspiration, a very bulb-like typical slender heart can be seen with a very good clear markings which are not obviously present here. Other things which can also help us is the costophrenic angle. So this is diaphragm, and this is the rib. So this is what is we call it as costophrenic angle, which can be very clearly seen, and it is acute angle, means less than 90-degree angle. But here this angle is all blunt, it is not very well visualizable or very not very well appreciable. This is the rib, this is the diaphragm, and these are the ribs. So this angle is all lost, or angle is not very properly visible, just because this X-ray is taken in poor inspiration and not in deep inspiration. The other differences which we can point out is you can always see the anterior ribs will appear more of a flat or transverse. If you can see, this is the anterior rib, this is the anterior rib. It will almost appear very much flat, whereas in the if the X-ray is taken in deep inspiration, it will appear more of a oblique. This is more of a oblique, not in like flat here. You can see that this is almost like flat. Also, the angle between the anterior and posterior is almost a very much good diamond when it is in a good deep inspiration. For example, we know that this is anterior rib and this is posterior rib. So we can see a very nice diamond shaped structure or a diamond shape. We can very well notice the diamond shape because the oblique nature of both anterior and posterior ribs. But in this X-ray with poor inspiration, this diamond shape is totally lost. You will not be able to see a very good diamond shape because of the ribs will be more of a transverse than the oblique. So taking X-ray in deep inspiration is very, very, very important to very nicely see the lung fields, to very nicely see the cardiac shadows and the mediastinal shadow as well. So don't forget to ask the patient to take a deep breath and hold during taking the X-ray. Thank you.